allergy to any of the filler that that we might be using, you need to check that out. If you tend to be an easy bruiser or if you bleed easy, you should be cautious as well.
So I guess that's one of the benefits, again, to having someone like you perform the task rather than somebody out of their car or their home, because I guess you need some kind of medical, physical background to know about the patient.
Everybody needs a proper screen and a proper physical as well. Physical and history, extremely important.
Okay. So we have a demo with you today, and maybe you can walk us through what you're going to be doing. And while you're doing it, you can tell us how often we need to keep doing this to maintain it.
Absolutely.
And some of the cost.
Okay. So Botox typically lasts 3 to 6 months. 6 months if you're really lucky. I'm not so lucky, but most people get about three months out of it. And my message for people who are using Botox is the more that you use, the less you have to use. Because after a while, your muscles just kind of forget to express that way. So,
it wears off then?
It wears off. Botox and fillers are completely temporary, and Botox lasts for about 3 to 6 months. Wow. So we're not doing anything permanent, and that's a good thing in fact. Yeah, for sure. It's a good thing. So this is Mia, and Mia is my fabulous model today. Mia has a couple of Botox concerns that are really, really typical for most men and women. Mia, one of the things that you mentioned to me is that oftentimes when you are frowning or concentrating or thinking too hard, you get these number 11s before. So I want you to do this for me. Okay. So these aren't actually disastrous number 11s. But you know what? I always say for Botox, it's a little bit about wrinkle prevention. What happens is if you continually use those muscles, because that wrinkle is caused by the muscle, the skin eventually remembers where to wrinkle. And you'll get a dynamic wrinkle turning into a permanent wrinkle. So when you're not even expressing, you'll see those chronic grooves. So in a way, Botox can be wrinkle prevention. All right. So again, a nice big frown here for us. So this is called the glabellar region right here, and we're going to relax those muscles. It'll last about 3 months for her as well, and this can be done in a way that she'll probably have a little bit of motion. I always like to see a little bit of natural expression. Another area where we're going to target for Mia today is her forehead. And while Mia has fantastic thick skin, she does tend to wrinkle up here when she has a quizzical or a surprised look. We'll just relax this and freshen this a little bit. She'll be able to move it, but not wrinkle there. Another common area is the crow's feet area right here. And Mia has no crow's feet today.
So in addition to stress and just thinking and that sort of thing, can sleeping on your pillow a certain way bring on these marks?
You know, anytime you're sleeping, especially if you're sleeping on your back, all the blood in your body redistributes completely evenly through your body, so you don't have gravity working for you. So the answer is yes, you can become more swollen and puffy in your face. Some of those wrinkles can look a little bit worse, especially right when you wake up. Usually, though, with time, those kind of wrinkles and swelling go away.
Okay.
Okay. So.
And you'll let us know if you feel any pain, Mia. Okay.
I'm feeling the pain.
You're feeling the
already.
Pain. Okay. So the first thing that we want to do is cleanse Mia's face properly. And the nice thing about Botox is that it goes to work pretty fast. You see the results in about 3-4 days starting to come out, and you get the full effect within a week. So it's something that comes on really nice and gradually. So this is what Botox looks like. It comes in a little bottle. I don't know if you can see that or you can zoom up on it. And it is, saline is put into it to make it all into an injectable solution.
And you know, it's good that you're showing this because some people worry that they're not getting the full content of the bottle when they're getting the shot.
That's right. So if they're just injecting saline. Okay, so the first thing we're going to do is inject into the glabellar region here. And usually in this area, about 15 to 25 units is a good place to start. And I don't know if I'm blocking the camera here. Good.
So you're not feeling any pain there.
And
Doesn't
get
look
to
like
use
she's in pain.
tiny little baby needles here. It's very, very important that you go to somebody that understands the anatomy, especially when it's around the eye area.
Yeah.
There's some muscles that we definitely do not want to have relaxed, and it can cause some eyelid drooping. Okay.
Mia, what does it feel like?
Just a little pinch.
Okay.
It's painless.
Like comparable to a mosquito bite?
Exactly.
Is it typical to
usually you get a little bit
swelling, little nothing?
Just no swelling,
bruising.
But very, very rarely bruising. And Mia has thick skin, so it's unlikely that she's going to bruise here.
Okay.
So that's 25 units right there.
I think we have the giveaway color on the line. Okay.
Very, very good. Now we're
and this will last her for what, 3 to 6 months?
About 3 to 6 months, absolutely. Yeah.
Okay. And so how much would that particular, like that area that you just did, how much would that cost?
In my clinic, that's about $300.
That's not terrible.
$300. It's absolutely affordable in the sense that people go out and spend, hundreds of dollars on shoes or even special creams that aren't going to, work, or it's a treat that you do for yourself every, 4 or 5 months.
And is there a payment plan that you offer? Or?
In my clinic, we do have a payment plan that you can do. There's a variety of options that you can have.
Oh, that's good.
Okay, so Mia's not going to notice anything for about 3-4 days, and at that point she will start to notice a heavy feeling as the muscles just begin to relax. Now, we're not fully paralyzing these muscles, we're just relaxing them. It's going to be harder for her to do that. So there's no numbness that you feel with Botox, but there can be an associated heavy kind of feeling. So the next is the forehead. It's really important that you don't ever let anybody do too much Botox in the forehead, because it can relax the muscle and you'll get really, really heavy brows. They'll come down low. So give me eyebrows up very, very high. Excellent. So we're just going to do a little bit right in here. Again, we just want to break the muscle. We don't want to overdo this. Perfect.
Okay, we need to wrap up.
Okay.
So I'm just going to mention again for the callers, and here you can do the phone number again, please. You have the giveaway today. One area of Botox similar to what we're seeing here in the demo on Mia. Worth $300. You have that giveaway to the first caller in. And our number in the studio is
416-204-9723.
And there we go.
Thank you.
And let's mention your website address as well.
Yeah, so my website is Dr. Torgerson, one word, TORGERSON.com. I'm at 70 Yorkville Avenue.
Okay, great. And thank you for being here, and thank you for giving us this demo today, and thank you to Mia. And if there's any other questions...
Janet.
You're welcome. If there's any other questions, where can patients call you at?
Yep, they can call me at my clinic at 647-343-0207.
Great. And then we went a little over today,
Whoa.
but
yes, well, we're going to fix it in editing, so it's not a big deal.
Okay.
We're having fun.
It was fun. Yeah, thanks a lot,
Thank you,
Dr.
Appreciate it.
Torgerson, and
thank you.
And
Thanks, Mia.
and brave model over there for doing this.
I remind everyone that this is the outer diva and the inner diva with the Courageous Living is on October 22nd, www.courageousliving.com, info@courageousliving.com. And me, I have my giveaway for the Femtour Circle, June 29th, 3 hours. You can contact me at www.yourmarketingmagnet.com, Jeanette, JANETTE @yourmarketingmagnet.com for that. And I'm not gonna be doing my segment next month. I'm taking a little vacation. It's summer. But I'll see y'all in August, the third Monday of the month.
All right. So thanks everybody for tuning in, and we'll see y'all tomorrow at noon for more Liquid Lunch right here on thatchannel.com. Stay tuned. John Klotz coming up.
And we're in.